The Irish playwright George Bernard Shaw, a man who was never short of an opinion, gave us a line that should be etched into the mind of anyone who wants to leave a mark on the world. He wrote, "The reasonable man adapts himself to the world. The unreasonable one persists in trying to adapt the world to himself. Therefore, all progress depends on the unreasonable man." We are raised to be reasonable. It's a synonym for being sensible, cooperative, and sane. But Shaw presents a chilling alternative, that to be reasonable is to accept the world's flaws as they are. That true progress, the kind that reshapes our reality, doesn't come from adapting to the status quo. It comes from the stubborn, obsessive, and often maddening refusal to do so. It comes from being profoundly, and sometimes dangerously, unreasonable. This isn't a call for mere rebellion. This is a story about the brutal cost of being right in a world that is comfortably wrong. Let me take you to Vienna in the 1840s. The Vienna General Hospital was one of the most prestigious medical centers in the world. Yet, within its walls was a chamber of horrors. In the maternity clinic run by doctors and medical students, new mothers were dying at an astonishing rate, sometimes as high as 30%. They were dying of something called puerperal fever, or childbed fever. It was a terrifying, agonizing death, and to the greatest medical minds of Europe it was a tragic mystery. The cause? Well, the reasonable explanation was that it was an epidemic, like cholera caused by a miasma, a foul, invisible cloud of disease that drifted through the wards. It was unavoidable. It was just the way things were. To accept this was to be a reasonable physician. But there was a young Hungarian doctor working at the hospital named Ignaz Semmelweis. And he was not a reasonable man. He was obsessed by a single, maddening discrepancy. There were two maternity wards in the hospital, one run by the doctors and another run by midwives. In the midwives' clinic, the death rate was consistently dramatically lower. Why? It was the same hospital, the same air, the same fever. For a reasonable person, it was a statistical quirk. For Semmelweis, it was an intolerable question that began to consume him. He investigated with a frantic energy. He ruled out every variable, from birthing position to religious rites. The answer came to him through a tragedy. A colleague of his died after being accidentally cut by a student's scalpel during an autopsy. His friend's autopsy revealed a pathology almost identical to that of the women dying from childbed fever. Suddenly, the horrific pattern clicked into place. The doctors and students would perform autopsies on corpses in the morning, and then, without any meaningful cleansing, go directly to the maternity ward to deliver babies. The midwives did not perform autopsies. Semmelweis formed a radical hypothesis. The doctors were carrying cadaverous particles from the dead to the living. He proposed a simple, and to him, obvious solution: a strict policy of washing hands with a chlorinated lime solution between autopsies and examining patients. When he instituted this policy in his ward, the death rate plummeted to less than 1%. It was a miracle. It was undeniable proof, and the medical establishment destroyed him for it. His discovery was not seen as a breakthrough. It was seen as an insult. How dare this young doctor suggest that they, gentlemen of science, had unclean hands, that they were the agents of death? It was offensive. It was absurd. It was, in a word, unreasonable. His data was ignored. His contract was not renewed. He was mocked and professionally exiled, forced out of Vienna. He returned to Hungary, where he wrote desperate, furious letters to the leading obstetricians of Europe, calling them irresponsible and murderers for not adopting his methods. His tone became more frantic, more obsessed. He was a man screaming a world-changing truth that nobody wanted to hear. Ignaz Semmelweis died at the age of 47 in a mental asylum. possibly from an infected wound sustained from a beating by the guards. He died from the very type of infection he had taught the world how to prevent. Years later, Louis Pasteur's work on germ theory would scientifically prove what Semmelweis had known all along. The unreasonable doctor had been right. His simple hand-washing protocol is now the absolute bedrock of modern medicine, a practice that has saved more lives than perhaps any other in history. All that progress depended on one man's stubborn, agonizing, and personally ruinous refusal to be reasonable. He did not adapt to the world. He died trying to force the world to adapt to a better reality. So when you feel that friction, when your idea is met with the calm, reasonable resistance of "that's just not how we do things here," remember Dr. Semmelweis. Progress is not always a joyous march. Sometimes it is a lonely, desperate fight against the comfortable reason of the day. The question is not whether you have a new idea, but whether you have the courage to be unreasonable enough to see it through.